really was. But I want to take this back a little bit. I know that in the 1600s there were conversations in this country about education. Thomas Jefferson and George Washington, I know these are like teabagger heroes, so pay attention at home. They wrote letters back and forth to each other that education had to be a right. It had to be a right, and that this country was going to be built on a better foundation if people had a basic education. Basic. Now, granted, these people that had the right were white males, and these have been hard fought for women to be able to be educated as a right. This is a right not just for white males, this is a right for women. This isn't just a right for white males, this is a right of people of color. And these hard fought battles that have gone on and on and on. And now we don't even discuss whether education's a right or not. You have a right to public education. If you can't afford private education, you can go to private, you can go to charter schools, you can have homeschooling, for crying out loud, and build things with Legos all day. You do not have the right to not send your children to school. Right? I mean, are we all like, am I piercing the void here? So, you don't have, I mean, up to a certain age, you have to put your kids in some sort of education because we've made the agreement that this is a right and it makes us better. So why is it that this fundamental right, like you knowing how to read and write, is so crucial and so important? But if your kidneys work, or if you have allergies, or you're diabetic, those are not rights that are just covered. So at what point is this country, or I'm sure we're all pretty much on the same plane, that healthcare is a right, not a privilege, but that isn't reflected in our laws right now, and it isn't, that isn't bridged completely in this bill. So do you think that we're going to get to a point in this country where it's not discussed anymore that healthcare is a right? Vincent?
It's a good question. I don't know that, there's a lot of people that don't believe it is a right. I mean, obviously that there wouldn't be so much noise, coming from the other side if everybody believed it was a right that we have coverage. We wouldn't even be talking about whether it has a public option or not. It would. The problem has been all the way along that it's become, in our kind of unfettered capitalistic society, it's become a huge for-profit, business, and that's what we're seeing is the effect of a hugely profitable industry exerting a lot of influence to keep us from getting to what we think is probably a right that will actually cover people in the same way that education has evolved over the years. So, and I agree that right now what we're looking at is a bill that, there's a few things in it that I wish were different as well, but I think it's an incremental process, and there's a lot of good things. If we look at this bill now and didn't ever have any of those things that we're wishing were still in there, if we didn't have those in the beginning and you look at that bill, you go, wow, there's a lot of good stuff in here. I was formerly a trustee on the IBEW's Health Trust Fund, and just looking at some of the stuff that's in the bill right now are things that we were trying to, work on and get covered years ago, and I see them in there now, and then they're going to really help move the ball down the field, and that's what I look at as we started at the opposite goal line, and we're going to get to the 20 here on the other side, and we've still got 20 yards to go, and like Hollis mentioned, future Congress will look at that and hopefully help move the ball to the goal line and get what we all hope will happen.
So, and Monique, you're a doctor. How do you see healthcare? Is it a right? I mean, it's obviously how you make your living. People can't just knock on your door and walk in without, having some expectation to pay you for your services. But how do you see that, like, in a little bit bigger picture of that?
Actually, I believe in healthcare regardless of ability to pay. I was trained at Cook County Hospital, one of only 12 free hospitals left in the country. And so, I hope to get paid for my services, but there's one mom who's allowed me to speak about her case. She's a teenager that falls through the cracks with Denali Kid Care, and she can afford to pay me $10 a visit or $10 a month, and that's what she does. And, so I work things out for people that need solutions. So that's my personal belief. Your question about whether or not health care is a right, I think it's a long-standing debate in the United States, and I think it's pretty consistently believed to be a right and not a privilege. We don't reflect that in our laws, but I think we can. If you look at every president since FDR has attempted to reform health care. No one has gotten it this far. If you look at the fact that FDR talked about what his vision of the United States was, it included health care for everyone. When you look at when Medicare passed, 28% of Americans supported it. Senate passed it anyway. And today, 95% of people covered by Medicare would have it no other way. And so we can have the debate now. Once we bridge this hurdle and people start to see the real benefits in their lives, then you'll see the rallying around something that works. And we can get there. So, and I think it's important. Today, between 18 and 65, if you're, 1 in 3 of us is uninsured in that age group every year. And those people that are uninsured carry a 40% increased mortality risk. So I don't think I'm overstating the fact when I say doing nothing puts blood on our hands. And, you know, I don't think most of us want to live with blood on our hands.
All right, and on this panel, 1 in 4 of us doesn't have insurance. And we've got to run to a break, but I want to get your take on this as well. Because,
Can't wait.
You know, you'll be able to come up with something to like get them both when we come back after this break. I'm Shannyn Moore. This is More Up North. We'll be right back. All right. Woo! Welcome back. Really, I'm so glad that we have such a great panel. This is a panel that doesn't suck, but we haven't really had one of those yet, so we've done pretty well. Senator Hollis French, Dr. Monique Caraganis, and Vince Beltrami, President Vincente Beltrami, he likes to be called. So before the break, both Vince and the doctor had a chance to answer this sort of question, you know, backing up, at what point are we going to get to a place where we see healthcare as a right? Like education, and do you see it as a right? I mean, you're running for governor,
Sure.
and there's lots of sick people that still vote.
Sure.
So how do you see that?
You know, I've never really thought about it that way. It's funny, I've been struggling with the question, and probably, you know, from a strictly legal sense, from a constitutional sense, you might have a hard time deriving the answer that it's a right. But that doesn't matter to me. The real question is this, or at least from my perspective, it's a fundamental aspect of the human condition, right? We all are human beings, and you're going to get sick, and you're going to need help. And so part of the compact that I'm going to strike with you as another human being is that I will look after you when you're sick. If you'll look after me when I'm sick, and we will all take care of each other in our hour of need and bind ourselves together in this fundamental way that says, you know what, this is part of the human condition, and we're just going to try to look out after one another. And to me, it's just that fundamental. And so that's why, you know, that's why you have insurance, so that we'll all pool something together so that whoever gets struck by lightning gets taken care of.
Right.
And that's to me the basic idea.
Well, insurance is sort of a lottery you don't want to cash in on.
Exactly.
I mean, it just really is.
Right. I don't want to have to collect on my health insurance. I don't want to get cancer. I don't want to, you know, get tumors. That's all horrible stuff. But chances are one of us is going to get that, and it's a horrible thing. I just watched my mother die this year, and so, you know, I went through this, you know, and she had great medical care. She had great Medicare. Took great care of her in Florida. Oncologist, radiologist, cardiologist. I mean, anybody she wanted to see, you know, took great care of my mother. And it's part, but I just see it as part of the human condition. So, you know, it's not, whether it's a right or not, you know, who cares? Let's just be human to one another, take care of one another, and, you know, worry about other stuff when the time comes.
Well, I find it very disturbing that something so essential as that, you know, human need is a for-profit industry. And that's one thing that I'm not seeing broken down in this bill, is that it's penalizing them or taking that out of it. Like, the more you say no to people who are requesting care, the higher your profits are. How jacked up is that? Like, really? Yeah. So I'm going to give you my money, and then when you say, no, I'm not going to pay for this service, then I make money. I mean, that's crazy. And what they keep saying is, how dare we let the government come between us and our doctor? I'm like, really? I mean, this week I sat at the surgery center. Someone in my family was having surgery, and I listened to people around me for 5 hours arguing with their insurance companies about the person getting cut on in the back. And I'm like, this is sick. This is wrong, and this is a for-profit industry, which is something that's an essential need.
And folks should also clap for the fact that that practice goes away under the bill that passed the Senate. You know, they're going to put an end to the dropping of patients when they're sick, and that's a huge, huge change in the health insurance landscape. You know, so it's a step forward.
Did you want to answer to that, Monique?
Well, I think some of your points are very well taken. There is a fundamental flaw in where we have gotten to in our healthcare system, and a lot of it wasn't intended to become like this. When you have car insurance, you may not get into a car accident. That's why car insurance works. With health insurance, you know you're going to die. We're all going to die. But the interventions that can be done, I hate to break it to you.
Yeah, wait a minute. No.
So you're going to need your healthcare insurance, if only for preventative visits. And so we have really confused by allowing business models to come into medicine, has really confused what the outcome is. Absolutely, if you have brain surgery that's going to kill you, or brain cancer that's going to kill you in 6 months, and brain surgery is going to cost $500,000, an insurance company is going to play a tap dance that lasts 6 months and outlive you. And that is really unfortunate.